Amanda is here. And Sheldon, it's something that I feel like a stroke, I don't want to say sneaks up, because there are things, you know, months before, little things that could be a sign. I feel like a stroke is just something that I know we know a lot about, but I just don't know if everyone knows about it.
Absolutely.
And so I'm so glad you're here.
Thank you for having
May
me.
is awareness. We want people to know. But talk to me about it, because I just feel like people are like, oh, that's what that is? That's what
Absolutely.
could happen? I mean, it's so devastating. A
It
stroke
is.
is scary.
It very much is. So May is Stroke Awareness Month, and so we want people to know about the signs and symptoms of a stroke, and just not to call, or not to wait, but to call 911 as soon as possible. So we use the acronym BFAST for a stroke, and it stands for B is for balance. It
Okay.
could be loss of balance, dizziness, vertigo, uncoordinated movements, maybe you're falling into walls, that kind of thing, as well as E is for eyes, so blurry vision, double vision, loss of vision, one or both eyes. F is for face, facial asymmetry, numbness on one side of the face. A is for arms, arm weakness on one side of the body, or paralysis or numbing sensation. S is for speech, not being able to come up with the words or not understanding, so being confused. And then T is for time to call 911. So call 911 immediately. And all of these are sudden onset symptoms. So you either are fine 1 minute and then you are not fine, or you go to sleep fine and then you wake up and you have these symptoms.
Oh my goodness. Oh, I just want people to know. Do you think most of the time those things, I think people think this, oh, it just happens all at one time. I think it can be a month before, or it can be some times before. I think people just think, oh, it just happens right then.
Most of the time it does happen right then. You're fine 1 minute and you're fine you're not fine 1 minute
Okay,
later.
okay.
But sometimes there are, you know, some signs leading up to it. People have high blood pressure that they're not taking control of, and that can cause headaches and things
Okay.
like that.
Yeah, and let's talk more about the symptoms as well, because you're talking about, you know, the things, of course, there's lots of things to watch for if, you know, maybe somebody else is exhibiting those symptoms, but let's also talk about, you were mentioning to us in the commercial break a little bit earlier about the person who may be suffering the stroke. They themselves, you want to tell folks to talk about, like I said, you think about sometimes the symptoms they may be feeling, they may just brush off as, well, I feel tired. Talk a little bit about that as well, what folks should watch out for themselves as well as other people.
Absolutely. If you're exhibiting any of those signs and symptoms that I mentioned before, definitely call 911. We have a lot of patients who just think that they're tired. Maybe they slept on their arm wrong and they wait. So we say that time is brain. For every hour that you go without having blood flow to an area of your brain, you're actually losing 120 brain cells,
Wow.
or 120 million brain cells an
Wow.
hour. And that's a lot. And I need all my brain cells. So, you know, don't wait. Just call 911 as soon as possible, because time is brain, and there's certain treatments that we can do, but those treatments have time limits on them.
Right, and you were also mentioning as well, you know, like I said, people with high blood pressure, there's other things that can kind of contribute to that stroke risk. So what are some great ways to mitigate stroke risk?
But just make sure that you take your medication and see the doctor and follow up. So high blood pressure as well as atrial fibrillation are the two highest risks for having a stroke, and people just not taking their medication. As well as monitoring your weight, making sure that you're not smoking, you're eating all the things that we know that we should be doing. It's just hard to do sometimes.
Right.
Oh my goodness. Please be aware, because it can, people just think, it's not going to happen to me. It's not in my family. It's not, but just get with your provider and please talk about it. Are there things before, you know, look at your, go in, look at your heart, look at your blood pressure. I mean, you know, I think as people get older, they just really think it's not going to happen to them.
Absolutely. Just make sure that you're following up with your provider. But we're also seeing strokes in a lot younger population, such as in their
Really?
30s and 40s.
What?
And they might be having an underlying heart condition that they did not know about until they have the stroke. But someone in their 30s, they think that they're perfectly healthy and that their arm weakness cannot be because of a stroke. And so they wait to come in, and it can be devastating.
Oh my
Stroke
goodness.
is the #1 cause of disability in the United States. And a lot of it is preventable just by taking your medication and following up with your physician.
Oh, I'm so glad you said that. But that is, you think you're in your 30s and just not realizing. I'm so glad that you came in. If we want more information, I know that y'all have some great clinics, some great informational things, and I know May being awareness, but Where can we look and talk and get more?
So we do have some information on the Northwest website about strokes, but as well as the American Heart Association and American Stroke Association. Those are great resources for stroke prevention, what to do, and also how to help care for a loved one who has had a stroke. Because it's not just a
Yes.
patient who's had a stroke, it's the whole family. It affects everyone involved. It affects the kids. If they
Sure.
are younger, their kids, their spouses are now caretakers.
Sure.
So it really is a family involvement when this kind of diagnosis happens.
I'm so glad you said. What do you do at Northwest?
So I'm the stroke program coordinator.
Okay.
So I do a lot of education regarding strokes for both the staff of how to take care of a stroke patient as well as in the community too.
And what are you seeing in our area? I mean, I think you keep pretty busy.
We do. Yes,
Yeah.
ma'am, we do.
Yeah.
Like I said, we're starting to see a lot of strokes in their 30s and 40s. That's really is devastating.
Sure.
But just people just not taking their medication. And if they're not having access to their medication, they're not able to afford it, then there's resources out there. You just need to reach out to your physician who can help get those resources for you.
And there's so many more resources than even 5 years ago to even 10 years ago. I mean, there's more. There's a lot better for that education. Well, Amanda, I'm so glad you're with Northwest and
Thank you.
keeping folks educated. That it's important.
Thank you
I'm
so
glad
much.
you came today. Come back and see us.
Thank you so much for having
Always.
us. Appreciate it.
Sure.
Thank you.
Oh.